everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Tramadol. Its brand name is Ultram. Now before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So Tramadol is a centrally acting synthetic opioid analgesic. It exerts its activity by binding to mu-opioid receptors and also with inhibition of norepinephrine and serotonin reuptake. In terms of indications for use, Tramadol is indicated to be used in the treatment of moderate to severe pain, and it can also be used in dental pain. Now, before somebody was to use Tramadol, there are some contraindications that they must clear, as well as some precautions and warnings that they should be made aware of. This medication cannot be used by individuals who have respiratory depression if they're in an unmonitored setting without the proper resuscitative equipment available. It cannot be used by individuals who have acute intoxication to alcohol, hypnotics, or other narcotic agents. Children younger than 12 years of age cannot use Tramadol, and it also cannot be used by individuals who have elevated carbon dioxide levels in the blood. If a patient had a hypersensitivity to Tramadol or any other component of the product, they would not be able to use this medication. Tramadol cannot be used with monoamine oxidase inhibitors, and it also cannot be used if a patient have used a monoamine oxidase inhibitor in the previous 14 days. And finally, for contraindications, Tramadol cannot be used by patients who have a known or suspected gastrointestinal obstruction. Now, in terms of precautions, Tramadol is on the Beers criteria, which is a list of medication that the elderly population should either avoid or use cautiously. Because of the impaired psychomotor function and syncope that can sometimes happen with Tramadol, this would put the elderly population at an increased risk of falls, and in this population, falls can lead to fractures. There's a risk of abuse, misuse, and addiction with Tramadol, and patients would be at an increased risk of experiencing any of these if they had a history of drug abuse. Severe hypotension or low blood pressure and syncope or fainting has occurred. This medication must be used cautiously in patients who have hepatic impairment, and if a patient does have hepatic impairment and uses Tramadol, they should stay away from the extended release formulation. Potentially life-threatening serotonin syndrome may occur while using Tramadol. Patients would be at an increased risk of experiencing serotonin syndrome if they're using other medications that affect serotonin levels. Seizures have been reported with the use of this medication, and patients would be at an increased risk of experiencing a seizure if they were using dosing ranges outside of the normal prescribed range. It's not recommended to use Tramadol in patients who have suicidal tendencies. Patients over the age of 75 who use Tramadol will be at more increased risk compared to other patients at experiencing adverse effects. And finally, abrupt discontinuation of Tramadol may lead to withdrawal symptoms, so the medication should be tapered slowly upon discontinuation. Now, once somebody is cleared of the contraindications and made aware of the precautions and warnings, and they start to use Tramadol, they can expect to receive their dose orally. If somebody is using the immediate release formulation of Tramadol to treat moderate to severe pain, they would typically start off with 25 milligrams taken once daily in the morning. The dosing can then be increased by 25 milligrams as a separate dose every 3 days until 100 milligrams per day, or 25 milligrams 4 times a day, is reached. The usual maintenance dose would be 50 to 100 milligrams taken every 4 to 6 hours, and the maximum dose would be 400 milligrams daily. In dental pain, the patient may use 50, 70, or 100 milligrams as one single dose. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using Tramadol, so I'll go over some of those here now. Flushing can happen up to 16% of the time, and up to 12% of patients may experience pruritus or itchiness of the skin. Constipation can happen between 10 and 46% of the time, and up to 40% of patients may experience nausea. Up to 17% of patients could experience vomiting, and dizziness can happen up to 30% of the time. Up to 32% of patients may experience a headache, up to 10% may experience insomnia, and somnolence can happen up to 25% of the time. Now, some more rare but serious side effects would be hypoglycemia or low blood sugar, an allergic reaction such as anaphylaxis, difficulty breathing or respiratory depression, and serotonin syndrome can happen as well. That's all we're going to talk about today with Tramadol or Ultram. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.